Hi everyone. I can't tell if I'm live. I think I am. Okay. I think I'm live. I'm gonna go with it. Yeah, I think I am. So, hi everyone. I am thrilled to be here with you. My name is Dr. Rashmi Schramm, and we are going to have a lot of fun today. We're going to talk about some really fun breathing techniques. I'll tell you kind of why they work, and then we'll do some together. So it's going to be a lot of fun. Um, I think we should maybe wait for a couple of minutes, see if anybody can join us. Let me see. Okay, perfect. You know, okay, perfect. Hi, guys. I see there are a couple of you there. It's nice to see you guys, I think. I'm not sure. Okay, perfect. So, you know what? While we're waiting for folks to come along, I thought maybe I would tell you a little bit about myself. So, like I said, my name is Dr. Rashmi Schramm, and I have been practicing medicine for 20 years. I practice integrative medicine, and what that really means is that I get to integrate some really amazing lifestyle, Eastern medicine lifestyle practices into traditional medicine. I'm board certified in family medicine. And I really enjoyed teaching a lot of these breathing techniques. I also teach like a mantra based meditation. I also teach Yoga Nidra, which is a sleep based meditation. And it's just a lot of fun. So my wheelhouse is really kind of mind body medicine. And so I was thrilled when they asked me to do this particular talk. So, hi, Jean. Okay, so you are there and we are here and it's working. So that's great. I think maybe let's wait for another minute or so. Any questions, Jean? Anything you want to go over? Or any questions from any of you guys? While we're just waiting, we'll just wait like one more minute. No, you guys are a quiet bunch. We got some crickets chirping. Okay, so then let's get started because it's like 3 minutes after. Hi, Michael. Yes, yes, yeah. Looking forward, absolutely. And it's funny, isn't it? It's new to us in science, but it's these breathing techniques. My goodness, they're documented to go back 3, 4, 5,000 years. So it's really amazing. So, okay, so let's kind of get started. And let's talk about why we even want to talk about breathing and breathing techniques and all that. So, I mentioned that I've been practicing medicine for 20 years, and certainly in that time, one of the things that I saw most often and still do see is really stress related issues, right? So, we know that a long time ago, we blew past the level of like, good stress in our lives. And so the vast majority of us are sort of on the side of just having too much stress in our lives, right? There's just a lot of it that keeps piling on every day. And it can really wreak havoc on our health, both emotional, mental, and physical health. In some ways, it can show up. One of the main ways it can show up really is in an imbalance in our autonomic nervous system, right? So the autonomic nervous system, you guys know this already, has the sympathetic nervous system and the parasympathetic nervous system. So the sympathetic nervous system is great when we really need to run away from like that saber-toothed tiger, or really need to, swerve to get out, to save ourselves in an accident if we're driving or something like that. But when it becomes detrimental to our health is when we kind of lock into that fight or flight drive, or that sympathetic kind of overdrive for really long periods of time. And so it's, pretty well documented that, chronic daily stress is definitely affecting the vast majority of all of us. And so it would be wise of us to go, okay, how can I rebalance the autonomic nervous system and help my body mind heal? And one of the easiest and fastest and most immediate ways is through our breath, right? So I often think of the breath as being kind of that connection between the mind and the body. And so that's really why I wanted to do these breathing exercises. And so what we really want to focus on today, because there are literally hundreds of these different breathing exercises that have been passed down from generation to generation. So I really want to focus on at least two, and if we have time, I want to go into the third one to really activate the parasympathetic nervous system, which is our rest and restore response. So when we kind of reset the autonomic nervous system, and we might want to do this a couple of times a day, it doesn't take long. When we reset it, we're really bringing more balance back into our lives. And I think most of you would agree that most of us need more balance in our lives. Yes, yeah, Jean, absolutely. So, and this first breath is a great breath. I actually call it kind of a rescue breath, especially for when we're anxious and that sort of thing. So the first breath that we'll kind of go over is really, it has a lot of different names. And if you've been to a yoga class, maybe you've done this breath, or maybe you've heard of it, or if you've studied breathing, you've heard of this. But really, this is a simple thing. So it's known as coherence breath, or diaphragmatic breathing, or yogic breath. Either way, the most simple way that I think of it as is basically belly breathing, right? I mean, we're not really breathing through our bellies, but it's belly breathing. So when we breathe in, our belly goes out, and when we breathe out, our belly goes in, right? So it sounds pretty simple, but more often than not, especially when I'm seeing a patient, or nowadays a student, and they're really fighting a lot of anxiety, I'll say, show me how you take a deep breath. And a lot of times I'll see this, right? And so they end up as a default, or we all can as a default, of taking these really short, shallow breaths. And when we do that, it's fine. It helps us to get through a minute or two of something immediate. But the problem is, if we end up feeling or knowing that we're stuck there, is we're only using about 25% of the lungs capacity. And then in addition to that, we're actually sending some signals back up to the brain that's already kind of anxious. We're sending these signals to the brain that say, oh my gosh, things aren't okay. And so you kind of, go through this whole cycle of, anxiety or panic, or just feeling really more stressed. So we're going to reverse that. So what we're going to do is breathe a much deeper breath. And really what tends to happen is, right, so I'm pretending like this is the diaphragm. We all know what the diaphragm is, right? So it separates, it's a muscle. It goes all around, kind of goes all around the abdomen and the back, and it, reconnects over here at the spine. And it's a muscle that when it's activated, when it goes flat like this, it actually activates the vagal nerve. So the vagal nerve is the single most healing nerve in our bodies, right? So it is the 10th cranial nerve. I still remember dissecting it in medical school years ago because it was so big. It was really a phenomenal thing to see, and it has it has sort of branches everywhere. So it goes through the trachea, the esophagus, it talks to the lungs, it talks to the heart, and it's kind of got a big splayed out over the diaphragm. And then, of course, it goes into the GI tract as well. So, and what the vagal nerve is doing is it's collecting information and data from our bodies, and it's taking it right back up to the brain. And so what we're going to do is we're going to be really smart, and we're going to use that particular signal category or pathway to kind of calm our minds with our bodies, with our breath, right? So yeah. So you always feel like you do the belly breath wrong. No, it's true. It's don't overthink it and don't force anything. So the best way to do it, let's do it. I don't know if you guys can see my belly. Maybe you can. Either way, you pretend like you see my belly. Okay, so I usually put both my hands right on my belly, And, you know, just kind of sit up straight, but you can do this lying down. I have a couple of patients that I've taught this to that feel like they feel better doing it lying down. So either way is fine. And so what we'll do, I generally like to close my eyes. And in general, we want to breathe in for a count of 4, and we want to breathe out for a count of 5, right? So as we breathe in, the belly goes out. And as we breathe in, as we breathe out, the belly goes in, right? So maybe I'll just stand up to show you guys. So, okay, let's take a few of these breaths together. And so let's just, you know, kind of just relax a little bit and no forcing. So let's start our count of 4. So we'll breathe in for 4. So belly goes out, right? And then you're going to breathe out and your belly comes in for 5, right? So I'll sit down and let's do a couple of rounds of this one, okay? So let's just close our eyes and let's do another couple of rounds. So breathing in, belly goes out. Breathing out, belly goes in for a count of 5. 5. I'll let you guys breathe on your own. Let's do one more. Breathe in for a count of 4. Your belly's going out as you're breathing in. And as your belly's going in, you're breathing out for a count of 5. So it might seem like it's hard to do right at first, but you know, the more you do this, just like anything else, the better you get at it. And over time, the diaphragm, just like any other muscle, will get stronger and stronger. And over time, especially if you practice this, let's say for even 4 or 5 minutes a day, this diaphragmatic breathing, over time, that diaphragm actually gets a lot stronger. And they've shown in studies that, you know, within just 5 weeks of practicing this every day, that our default sort of mode of breathing will flip right into this kind of breathing. And I've certainly noticed that about myself. And a lot of times patients tell me this as well. They start to notice, you know, if they're like standing in line and they're finding themselves really annoyed, they just go right into just the belly breathing. All you have to do is really, you don't have to have your hands on your belly. It's just when you're learning, it's easier to do it. All you really have to do is just kind of, you know, you're not really breathing in through the belly. As the diaphragm comes down, you know, the intestines are being pushed out is really what it is. And so generally for almost all of these exercises, you either want to breathe equally, you know, inhalation to exhalation, or almost always you want the exhalation to be just a tad longer because that's actually more relaxing. That actually is what activates the parasympathetic nervous system. So you got, Jean, did you feel like you got that pretty well there? And so that's one of them. So, right, that's the first one. And if all you get out of this whole entire thing or any breathing exercises is simply that belly breathing, then you've already won. You've already gotten a huge amount of information and, you know, you're on your way for self-healing, especially if you want to do this every single day, right? And you'll start to notice this right away. Okay, so let's move on to the second one. And, you know, in Sanskrit, so remember I kind of mentioned that these breathing techniques, they, you know, we know, you know, in written texts, we see them about 3,000 years ago, but, you know, we know that in oral traditions, this was handed down you know, for probably maybe 4,000 or 5,000 years. We're not sure. But in any case, we have done, you know, over the last 2 decades, we have compiled a great deal of scientific studies that show the validity of these practices. Especially one of my favorite ones might be this next one I'm going to teach you, right? So good question, Jean. Makes a lot of sense. Yeah, so why do some breaths have pauses? Yeah, definitely there are some that we do with pauses. Sometimes I feel like if I'm teaching, like I'm just pretending like you guys don't know how to do these, even though I know you probably do. So I just think it's a little bit simpler Like in my years of teaching, I just feel like it's been a little bit simpler if we work on, inhalation and exhalation. And then as they progress a little bit more, like especially like I have members in my practice that have been teaching, after a few months, and they feel like they're really in a good place, then we'll start to add in some more, complexity to it. So really, there's not a reason for me not to tell you to pause, except for I think it's a little bit simpler to get the hang of it if you don't have to worry about the pause, because I've noticed that people kind of get tangled up in some of that. But that's a great question. So this one, we're actually going to use a mudra. It's called the Mrigi mudra. I know it sounds, looks kind of crazy, but so the easiest way to do it is like you take your peace sign and then you actually put them down. So you're going to actually do this thing. So what we're going to be doing is called Nadi Shodhana is the Sanskrit name for it, but it's really alternate nostril breathing, right? So, and I'll show you how. We'll get through it together. But this is a really powerful breath. This is incredibly powerful. And you start to notice that I think, just within a few, just like a minute or two. So what we've shown in studies, and this has been replicated multiple times, is when we're breathing in through the right nostril that we're seeing activity in the left side of the brain. And we're breathing in through the left nostril, we're seeing activity on the right side of the brain. And we also know that obviously the left side of the brain controls the right side of the body and vice versa. And so what really we're doing is we're bringing, again, more balance and more sort of coherence, if you will, between both hemispheres of the brain. And we can do that by simply practicing this particular breath for, just 2 or 3 minutes a day. Okay? So remember that, kind of mudra that I was telling you about. I kind of have a little hard time doing it, but I've been doing it for a while and I don't mind looking like this. So, if you guys have a hard time, you can always just keep it like this. So keep your hand like this. So you'll take your right hand and, just relax. That's the main thing with all of these. Like we just really don't want to feel stressed out about these. That's the first and foremost thing, right? So we want to take these with a light attitude and we want to, enjoy doing them too. It shouldn't have to be like one more thing for us to do, right? Okay. So what we'll do, and I don't think I need to necessarily, do anything else. So I'm sitting really comfortably. And so what we'll do, and I usually like to close my eyes, right? So I'm going to do that. You guys can keep your eyes open if you'd like, especially for the first one, and I'll kind of talk us through it, right? So what you'll do is with your right thumb, you'll close off the right nostril. And then when I ask you to, with your ring finger, you'll close off the left nostril, okay? I'll just do a round of these and then I'll see if you guys have any questions, okay? All right, so let's just begin. So what you'll do is you'll close off the right nostril with your thumb, breathe in through your left nostril. Then you'll close off the left nostril with your ring finger and breathe out through the right nostril. Breathe in through the right nostril. Close off the right nostril with your thumb and breathe out through your left nostril. And we'll continue on like that. That's one cycle. Anybody have any questions? Otherwise, let's just do a few of these together, okay? So just kind of sit up straight. You can have your left hand just, gently on your, on your lap, and then just gently close your eyes. And let's start by closing the right nostril and taking a nice deep breath in through the left nostril. Closing it off. Breathing out through the right nostril. Breathing in through the right nostril. Closing the right nostril and breathing out through the left. Breathe in through the left. Close off the left nostril and breathe out through the right. Do one more round, and if you feel ready for it, you can do the same count of 4 inhaling and 5 exhaling. So inhale through the right. Exhale through the left. Inhale through the left. Exhale through the right. Inhale through the right. And exhale through the left. So, yeah, okay. It should feel really relaxing and very calming. So, I have definitely had folks do it really too fast. They might feel dizzy. Absolutely, it's possible if you're doing it too quickly to feel, like you're winded a lot of times. So just like I said, just take it easy and really just go as slow as you feel like you need to go. And a lot of times you might just, if you're paying a lot of attention, you might just notice that there is that pause, and maybe that pause is going to get a little bit longer between each one. And there are definitely, kind of the advanced practice of this. There is a pause where we hold our breath, but again, I feel like that's a little bit advanced. And so if all you did was just the alternate nostril breathing, you would have huge amounts of benefits from that, right? So, I think, any questions about that other than did you go too fast? No. Okay. We actually have like 8 minutes, and so I can do a really fun one if you guys up for it. So this one again, we're dealing with the vagal nerve, right? So and what we're gonna do is we're actually gonna make some noise, and some. It's gonna be embarrassing. It's gonna be embarrassing noise, and so what we're going to do is we're going to vibrate the vagal nerve, and so it also stimulates the vagal nerve. And so we have studies that show, and this particular breath that I'm going to teach you is called the Brahmari breath, or the bumblebee breath. There's studies that show, there are two studies, actually there are two breaths sort of similar that can kind of stimulate the vagal nerve with vibrations. But this one in particular was very equivalent or close to these vagal nerve stimulators that we use for a variety of different things in medicine. So it's really a very, very strong way to sort of induce calmness pretty quickly. And so let's see, is there a good breathing technique to help calm a racing mind? Yeah, absolutely. So honestly, the best one is that diaphragmatic breathing. In fact, I do it every single night. As soon as I get in the bed, I do a few rounds of that where I just put my hands on my belly, and I breathe in for 4 and I breathe out for 5, and and just kind of be easy with it. And that's a really phenomenal way to let go of all that stress that's accumulated during the day, and you'll find yourself drifting off to sleep a lot better too. So that's a good question. So for the Brahmari breath, so the Brahmari is actually a very small Indian bumblebee. So that's why it's named after this. And we're going to hum like the bumblebee, if you guys are ready. I think you may have heard my dog barking. She's probably going to bark again when she hears me do this, so don't worry about it. She's just worried, make sure that I'm all right humming in here by myself. So what we'll do, and I'll show you kind of how to do it first. So we're going to very gently close off our ears, not all the way, but sort of very gently close off our ears. And then your fingers can just rest on your scalp, just kind of rest, and your tongue is going to go in between at the top of the palate, and your tongue is going to go in between the your two front teeth, really, right? So that's a very well known acupressure point and a marma point. So it's very well used in a lot of different breathing techniques. And so the tongue just kind of goes up here, and then we're going to hum like the bumblebee. So let's go ahead and do it. And, I think if my teenage children see that I've done this on some kind of social media, they will be mortified, but they'll be all right. So what we're going to do is we're going to go ahead and just very gently, I like to close my eyes. I just feel like it's a more powerful experience. So we're just going to very gently close our ears, and then we're going to take a deep breath in, and then on the exhale, we're going to hum like the bumblebee and just let it go as many pitches as you want, okay? So deep breath in. Did you guys do one? How'd you feel? Let's do two more rounds together, okay? All right, all right, gently close off. There you go, your ears, not all the way. And then tongue in place, breath in, and hum. One more time. Yeah, that does tickle your tongue, huh? It's a good place for it actually. Kind of automatically relaxes the jaw whenever we put our tongue up in that space there. So I think I'm about to run out of time. So those are three really powerful techniques. And if you have time, just kind of go back through because you might learn something new. Just kind of go back through and see if you wanted to see it again, right? So the most important one of all of these is that first one, that coherence breathing. And once you've nailed that one down, and it doesn't take long, it's just a matter of practicing it, that's all. Then, it kind of opens the door wide for so many other, possibilities. But all three of these that we just practiced are incredibly powerful. So be gentle with yourself. And my recommendation for, my patients after I teach this to them, or if I'm teaching a class to my students, is really to do just, possibly just the, alternate nostril and coherence breathing for 5 minutes in the morning and then 5 minutes in the evening. So just like find a time, at the end of your day when you're just ready to let go of all of those stressors that have been piling up. And just spend 5 minutes. You can set your timer and you can spend 5 minutes doing these two, or if you wanted, the three exercises, and you'll just start to notice over time because these things are very subtle. Even though you might notice some immediate benefits, really the bigger bang for your buck is when you do these for over a long period of time. And I suppose long period of time, I just mean a few weeks, and then you'll kind of just go back to doing them sort of out of habit. But we've seen that people have completely reset their sympathetic, from the sympathetic tone over into the parasympathetic tone. And I see it personally with my patients. I mean, they make these phenomenal kind of switches as far as kind of whether it's with panic or anxiety or just stress. We all have a lot of stress. There's we've already had a lot of stress, and then on top of that there is kind of a very long and elongated global pandemic. And so that kind of, heightens everyone's stress. And so some of the benefits, obviously, when you start to decrease the sympathetic response and it's really phenomenal. You see decreased inflammation, which is amazing. You start to see an improvement in the immune function. People start to be able to sleep a lot better because they're really turned off the cortisol and the adrenaline and all of that stuff that comes with the fight or flight response. You really start to see what's known as homeostasis, right? So that's sort of that's self-healing, that's dynamic, sort of non-change. That's what homeostasis really is. So you really can turn on a lot of self-healing mechanisms just with your breath. And it's a really powerful technique. So if kind of the takeaway then for this would be just to really make some space in your day-to-day, activities. To do these every day. That's when you're really going to get the biggest bang for your buck out of this, is to just try to do them with some amount of regularity. Okay? Oh, good. Yeah, it is surprisingly relaxing. It really is. Yeah, and you can get some immediate, biofeedback. That's really what you're doing is you're getting biofeedback. Yeah. And you're telling your brain everything is totally fine, which is why you start to feel relaxed just pretty immediately by stimulating the vagal nerve. Yeah. So I think my time is up. Oh, good. Fantastic. I'm glad you guys enjoyed it. And thank you again for having me here. It was my pleasure. And I will see you guys later, okay? Enjoy doing some breathing techniques every day. Okay, let me find out.